Welcome everyone. Do we have quorum, Ms. Clerk? Or
Yes, Sylvia should be chairing, I believe. I'm
Yes.
not chairing.
Yes,
okay.
Mayor, we do have a quorum today. Thank you.
great. Well, we want to call this meeting to order. Welcome to the January 21st Sandag Public Safety Committee meeting. Before we get started, I'd like to ask our interpreter to be introduced and walk us through how to access our interpretation services for today's meeting.
Thank you, Chair Sotelo Solis. I will begin with the instructions in Spanish and I'll be back with the instructions in English. Muy buenas tardes y bienvenidos, bienvenidas a esta sesión del Comité de Seguridad Pública de Sandag. Se está ofreciendo servicio de interpretación simultánea. Para hacer uso del mismo, por favor desplácese a la parte inferior de la pantalla de Zoom donde aparecen sus controles, haga clic en el icono de interpretación, parece un globo terráqueo, y seleccione Spanish o español. Si está utilizando la aplicación móvil de Zoom en celular, tableta, etcétera, presione primero los puntos suspensivos, luego interpretación y luego el idioma. Por último, si no desea escuchar el audio original en inglés en el fondo, por favor seleccione Mute Original Audio o silenciar audio original. Once again, interpretation is being provided to and from Spanish. To use the feature, please scroll down to the bottom of the Zoom screen where your meeting controls are. Then click on the interpretation icon. It looks like a little world, and then select English as your language. If you are joining through the Zoom mobile app, that is on a cell phone, tablet, or other mobile device, first press the ellipsis, the three dots, then interpretation, and then choose your language. Finally, click on Mute Original Audio to not hear the original Spanish low in the background. Gracias, and thank you, Chair.
Gracias, Carlos. We appreciate you. Bueno, we now go and let's start with the Pledge of Allegiance. Please join me. Right hand over your heart, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Before we jump into the meeting, I'd like to ask our clerk to confirm that we have quorum. Ms. Sylvia?
Yes, Chair, we do have a quorum, and I can confirm that.
Thank you so much. So I'd like to remind everyone about our process for both member and public comments. Members are asked to use the raise hand icon in the Zoom toolbar and turn on their cameras when they have a comment or a question, and then I'll recognize you. And if you are a member of the public and would like to speak on an item, please use the raise hand icon in the Zoom toolbar once we reach that item on the agenda. And if you're calling into the meeting, please press *9 on your phone if you'd like to comment on an item. All comments, whether emailed or live, will be made part of today's meeting record. Before we begin with agenda items today, we wanted to again thank Vice Chair, because we were contemplating whether or not I was going to be able to make it past security. I want to thank Kaylin Frank for stepping up to have chaired, but we wanted to again thank her for stepping up because if I didn't make it, she was going to step in. So thank you, Kaylin. You're off the hook for today. We do want to, again, I heard a little birdie tell me that somebody is going to be retiring soon. So we want to congratulate Sheriff Gore for his retirement. I don't know, Sheriff, if you had any words that you wanted to share, partake.
Thank you, Chairman. I appreciate that. Thank you for the recognition. It's been a pleasure being a part of this committee. I think Sandag Public Safety is a great example of why things work so well in this county, how we work not only collaboratively with our law enforcement partners, with our elected officials. So thank you, and thanks for the recognition. It's been truly my honor.
Thank you so much. I apologize. My earbuds went out, but I want to say congratulations. We know that you've done quite a bit for our communities and wish you the very, very best. Any big plans though? I mean, outside of, leaving a gig here at the county?
Well, I'm already on a couple of boards and just went on another board. So I'm sure it'll be enough to keep me busy and maybe even time to play a little golf, and you never know. So thank you.
Yeah. And I've heard once retirement hits, there's a honeydew list. It's very sweet and very long.
Yeah. Thank you.
Well, congratulations, Sheriff.
Thanks.
So now we go into the first item for today, and that's approval of meeting minutes. So I'd like to see if there are any members of the public that would like to address us on this item. Ms. Clerk, are there any members of the public wishing to address us on this item?
No, Chair, there are no members of the public.
Are there any Public Safety Committee members that would like to address us or share any feedback on item 1? Seeing none, I need a motion to approve the minutes.
So moved.
If you could just state your name.
Anderson.
Anderson, we got a motion. Member Anderson.
Goebel
Second,
second.
Gore.
Ooh, that's a toss up. We'll go with Goebel. Made it in. All right. We have a motion and a second. Any other discussion? Seeing none, please call the roll.
For the Sheriff's Chiefs Association Seat A, Chief Chuck Kay. I haven't seen him log in, so perhaps he said he would be participating, but I don't see him log in. So I'll count that as absent. For the Chief Sheriff's Association Seat B, Chief Fred Armijo.
Approved.
For City of San Diego, it looks like they're absent. So I'll call that as an absent. For the County of San Diego, Supervisor Joel Anderson.
Aye.
For San Diego County District Attorneys, Commander Barbara Rutzel.
Aye.
For East County, Council Member Steve Goebel.
Aye.
For Regional Fire Emergency Medical Services, Chief Rick Boyd.
Aye.
For North County Coastal, Council Member Keith Blackburn.
Aye.
For North County England, Council Member Ed Musgrove.
It's
We also
actually,
have, I'm sorry, we have Council Member Kaylin Frank. And since
Yes.
she is a member, yes. For San Diego Police Department, Assistant Chief Paul Conley.
Aye.
For San Diego County Sheriff, Sheriff William Gore.
Aye.
For South County, Honorable Alejandra Sotelo Solis.
Sotelo Solis, aye.
Thank you. The item passes.
Thank you so much, crew. We are now on item 2. Item 2 is, hold on 1 second. My picture cut off. Item 2 is any public comments. Again, this is on any comments regarding issues not on today's agenda. If any member of the public would like to comment, please raise your hand. And Ms. Sylvia, do we have any members of the public wishing to address us on items that are not on the agenda?
Chair, I do not see any public comments on anything on this agenda.
Okay, any members of the Public Safety Committee? Anything you guys want to share? Anything? Okay, moving on. We now move on to item 3. It's the Chief Executive Officer's report.
Thank you, Chair Sotelo Solis. Safe travels to you. And Sheriff Gore, thank you for your service. Wish you well in retirement. If you ever need a golf partner, I am ready. But thank you. Happy New Year. I want to wish everyone a Happy New Year. I hope you are staying safe and healthy with your loved ones. It continued to be unprecedented times. I remain proud of our agency and how we have adapted to changing condition and continue to serve the San Diego region. And again, under a very difficult circumstances for all of us as a nation, as people, that I hope the other side of it would look brighter. As we begin 2022, I wanted to take a moment to recap some of our highlights and talk to you about things that are coming up. Let me start by saying some of you were celebrating with the 8,500 residents of the region on November 22nd, the opening of the largest infrastructure project in San Diego's history. That's the Mid-Coast Trolley. That was an amazing day where the community and our leaders celebrated an amazing project that's going to connect San Diego further. That's going to guarantee a one-seat ride from the border to UCSD and going to make it possible to actually have an alternative to driving on the I-5. I just want you to know this largest project in San Diego's history was finished on time, on budget. And here I want to thank all of you for your leadership. I want to thank my predecessors, the previous leaders who made this day possible. Moving on, we also last year adopted the 5 big moves, the regional transportation plan. We received over 17,000 comments. We showed the region, the state, and the nation what a data-driven approach is. Yes, it was, have a lot of debatable issues. But as I said in the beginning, we don't have to agree always. We have to create a public policy debate so the public is informed. I am very proud of the work we did on the plan because I think it's setting precedent nationally and internationally. We also made progress in the third border crossing, Otay Mesa 2, you see here in this picture. We already invested about $600 million with our partners from Caltrans. We are ready to open this facility by September 2024. And for that to happen, we're going to continue to work hard as we move forward. But we're grateful for the partnership locally. We're grateful for our federal government. We're grateful for our partners in Mexico. And we're working as hard as humanly possible to move this forward. We're also moving quickly, as you know, in my 10-year here, short 10 years at San Diego, 3 times we had to slow the trains down. We have sometimes to stop the trains because of the collapse of the bluff. And we made it a point for Sandag. We went out and got over $100 million. And I want to appreciate Congressman Levin, President Tony Atkins, Assembly members, our delegation in DC. We were able to secure over $100 million to stabilize the bluff. And right now we're in the final design of the final stabilization project for the bluff. Furthermore, we started a study that's going to conclude shortly about moving the track of the bluff. So watch out for a lot of work to be happening this year and next on the Del Mar Bluff stabilization. We are also moving forward and as quickly as possible on building a central mobility hub in San Diego County for the 3.3 million San Diegans. I can tell you that right now we have 3 alternatives in consideration. One is at the Nabor site that our partners from the Navy working with us on. Second is in downtown San Diego. And the third is by the Fort facilities. Our hope and our goal is we cut ground on a central mobility hub in San Diego by 2024. Ambitious goal, but a goal worth pursuing. And we think it's important for the region to know that the future is going to look brighter because of the potential, not only connectivity, but potential economic and environmental sustainability that's going to take place as a result of this project. We also completed some significant bike programs, inland rail trails. We're planning to open Georgia Midlanders and 4th and 5th Bikeway project. And next week we'll break ground on the highly anticipated 2.3 miles Persian Bikeway. I'm happy also to report that last year we partners with the county. I want to thank our own Supervisor Andersons and his colleagues for making funds available to go further closing the digital divide gap by having a project on the 67, laying out 18 miles of broadband, implementing the governor's executive order about Digit Once policy. And we're going to continue to partner with the county to do more so we connect our resident to a good broadband. And last but not least, as this committee knows firsthand, ARJUS continues to serve as a critical forum for our regional law enforcement agencies. Last year, we completed agreements to share data across the region and received over 1.4 million to implement public safety solutions. This year, we are planning to develop a strategic plan and updated GPA and fee structure for ARJUS. And we are working to implement a new criminal mapping dashboard and system to share real-time data and multi-agency. This will connect computer-aided dispatching system across the 911 system in the region. Our criminal justice division also continues to provide timely information to the region to help inform our public safety planning efforts. As you can see, we have accomplished a great deal in last year. Been here for 3 years, and I am grateful to you and your leadership in moving the region forward and putting these priorities. But we have a lot more to do. And again, still unprecedented times in our history. With that, Madam Chair, that concludes my report. I'll be happy to answer any questions.
Thank you so much, Hassan. We really appreciate all the work and the leadership that you provided. On behalf of our wonderful staff there at Sandag, from all walks, we appreciate their helping to get the policy work done so we can give more direction on how we continue to improve transportation corridors, public safety, and more. I'm now looking to entertain any comments or questions from members of the dais. If you'd like to ask any questions of our CEO, please raise your hand. Seeing none, and I believe, Ms. Sylvia, are there any members of the public wishing to address us on this item?
No, Chair, there are no members of the public.
Thank you so much, Mr. Hassan. You are welcome to stick
Thank you.
around.
Thank you.
But you are done for the day. All right, thank you so much, Mr. Hikata. We now move on to item 4. It is the next generation regional computer automated dispatch interoperability program. And this is for information only, but we do have Mike Scott, who again, I really want to thank for his flexibility in today's presentation. And it's going to be an overview of the next generation program. So take it away.
Thank you, Chair. I don't know if Chief Vogt wants to make any opening comments. Chief Vogt,
No opening comments. Go ahead, Mike.
Okay, thank you.
Jump right in.
Just make sure. Go make sure recognize Chief Vogt. Yeah, so thank you, Chair, and the members of the committee. Just want to give you a brief overview of what I think is a really good story that has been going on for several years in the San Diego region amongst the fire and EMS responders. And we're doing some updates on the program right now. And again, I think it's a really good story of regional cooperation. So we are in the process of a next generation regional CAD to CAD. Next slide. So what is a CAD to CAD system? So just for, again, overview for everybody, a computer aided dispatch system is the system that receives 911 calls for emergency information. And this dispatches the emergency services specifically in this particular case, we're talking about fire and EMS resources. Again, the San Diego region created its first connection of the fire and EMS dispatch centers together about 11 years ago. So we have a long history of using this kind of technology for about 11 years, and we'll talk a little bit more about that success. We are under our current effort in progress to replace the original system with an updated version. And then the last part on the background is, I think it's always good to know that there are grant funds out there. And this program has been largely funded by the Department of Homeland Security grant program. The current effort is about $1.23 million. So again, we're taking advantage of a really good regional project and using Homeland Security grant funds to help support that. Next. So what does CAD to CAD do for us? What it does on the fire and EMS side is it gives immediate sharing of fire and EMS emergency incident information. And what used to happen before 10 or 11 years ago is if we needed to ask for help from our neighboring dispatch centers, we'd have to pick up the phone. That would take several minutes maybe to ask for help, or we'd have to pass along information, especially when we have incidents that border each other as our jurisdictions touch each other on contiguous boundaries. So that process of phone calls has been automated for about the last 11 years. That really saves a lot of time that we'll talk about here in a moment. And on top of that, the idea that it's shared electronically and there's no phone calls involved, it allows for that automatic dispatching of the closest fire resources, regardless of the jurisdictional boundaries based on mutual aid agreements. When you have an emergency as a heart attack or your house is on fire, the concept with automatic aid is you get the closest responding fire resources, regardless of the jurisdictional boundaries. So you may have a fire station that's around the corner from you that may be in another city or another agency's jurisdiction, but you will still receive that resource because we have this automatic aid agreement that is supported by this CAD to CAD connection. The last part of this, it does also provide some automated notification to our San Diego gas and electric partners for utility emergencies. That can be very helpful, especially when things get busy around weather events, that we're not making phone calls, we're sending automated messages. Next. So who are the members and participants? Currently the member public agencies are the City of San Diego, the County of San Diego, North County Dispatch Joint Powers Authority, Heartland Communications Facility Authority, and the City of Escondido. I'll talk a little bit more who that includes in just a moment. We have some other participating agencies for the last 11 years, including San Diego Gas and Electric and American Medical Response. We have on our to-do list and explore other agencies such as the Port Authority, because they touch the City of San Diego and with the airport. We have fire and EMS resources that are shared because of that boundary and that jurisdictional sharing. We are looking at our federal partners and Navy Southwest because they also have fire resources in the region that we do share already, the resources, but just not in an automated way. Next slide. So I think it's really important to understand that this concept of a CAD to CAD being the hub in the middle of this is where we allow these dispatch centers to talk to each other. And as I said, for instance, in the upper left-hand corner, the North County GAPA is many agencies, many cities, it's fire districts, it's tribal nations. So there are about 12 or 13 agencies within the North County GAPA. In the upper right-hand corner, we have the City of Escondido, who has their police and fire resources. And then we have the County of San Diego with CAL FIRE. And again, they have the County Fire Protection District and the CAL FIRE resources and several fire districts and also tribal nations. In the lower right-hand corner, we have the Heartland JPA, again, several cities, fire districts, and tribal nations together. And under the San Diego Metro, we have the City of San Diego, and then we have 5 contract cities between Chula Vista, Poway, Coronado, National City, and Imperial Beach that are included as that San Diego Metro. So while I only mentioned 5 member agencies, this really includes almost every fire agencies in this county under their Joint Powers Authority or the way our dispatch centers are set up. And because of that, like I said, almost all of our agencies have the benefit of this CAD to CAD system that goes through this hub so that where we have dispatch centers that have contiguous boundaries with neighbors, we use this automated system. And again, we also have AMR and SDG&E connected to this current hub. So I think it's really important to understand that really it's the entire San Diego operational area. Next slide. So I'll give you just a real quick example of what it means to closest fire stations. So here's an example of maybe a fire in the city of San Diego, in that corner where the flames are. There's a city of San Diego fire station off of Navajo. There's a El Cajon fire station off of Fletcher Parkway. And there's a La Mesa fire station off of Dallas and Fletcher Parkway area. When a fire comes in, it's going to get those 3 engines as an example. And while the city of San Diego may not be the closest fire station by drive time, it would get the La Mesa fire station, the El Cajon fire station, and the San Diego fire station all at once. This occurs through automated systems. There is no delay in phone calls. When the call comes into the city of San Diego, it knows that those fire stations are nearby and automatically dispatches them. This really is a huge time saver. We estimate that it's at least 2 minutes of time that is saved in making those requests for resources because they occur automatically. And as you know, in heart attacks or structure fires, time is really important that we get there quickly in order to mitigate the emergency. So it's a really good example of 3 cities that come together that we share the resources in a way that's very beneficial. Next slide. So why is it important? Again, I mentioned that there's minutes saved by sharing incident information electronically. The communications, the communities realize faster response time of fire and EMS mutual aid resources in an automated system. And I think this is important to know that the system we currently use, it has this type of incident data or information sharing about 8,000 times a year. So this is not just like a once in a blue moon scenario. This is occurring, many times every day. And on those 8,000 incidents per year, our communities are realizing the benefit of giving the closest resource in a way that saves many minutes of time in making that allocation of emergency responders. So I think kind of just in closing, I really do think this has been a great example for the last 10 or 11 years of where we have come together as a fire and EMS service to have regional cooperation with the benefit of serving our communities. And again, as I mentioned earlier, the other great benefit has been the availability of Homeland Security dollars to help fund this project, because without those Homeland Security dollars, I'm not sure that we would have been able to accomplish this kind of project, because there's sometimes we always struggle with finding monies available in our budgets. But it's a great example of a regional use of grant dollars with the end goal of making sure our communities are served in a way that really, again, is a good example of regional cooperation. So that really ends my presentation. I think the next slide is just questions. So again, I'll give Chief Boat an opportunity if he wants to weigh in, or if there's any questions of the committee, we'll be glad to answer.
Go ahead, Chief.
Okay, can you hear me?
Yes.
Okay, Zoom just told me that it quit working, so apparently it lied. I apologize. Yeah, I just want to thank Mike Scott for the presentation and sharing this information. And speaking as the Escondido Fire Chief, I want to share with you that this is the 2nd generation or the next generation of RECIP. The 1st generation, the technology that was built had a phase 1 and a phase 2. Phase 2 was supposed to include the city of Escondido, and that's been going on for 10 years. The technology never really was able to connect us fully. With the grant dollars that were allocated in this next generation, we're confident that all dispatch centers will be fully functional in San Diego County. And again, as a chief of Escondido Fire, I'm very appreciative of the fact that this next generation is going to be an advancement over the previous technology. And just to reiterate what Mike Scott said, this is how the fire service works. We integrate and cooperate regardless of where the jurisdictional lines are. And this technology allows us to see in real time through our CADs where those closest resources are and allow them to be deployed rapidly. So with that, I'll stop.
That's great. And I think it's, I mean, you hit nail on the head. It's a new technology. It's really kind of having that connectivity. So congratulations to you all for helping to really spearhead this effort. Change isn't always easy, but when it happens, especially on technology, it makes it easier, faster. We're doing a good thing, doing a good thing. So thank you, Chief and Mike. So I want to go to Councilmember Gobel. I do have hands raised for you.
Thank you, Mayor and Chair. A question, this is great coordination, the lab to seeing, we're catching up and making things faster for safety. My question is, does the system also have the ability to alert the need for special type of incidents such as hazmat or water rescue or multiple trucks in addition to engines?
It certainly is part of the response plan as we share resources for those specialized incidents. So I talk about fire and EMS, but it is all hazards. So it doesn't necessarily send alerts, but if we need to share resources of the swift water type or the hazardous materials type, then yes, they are part of that system. So it's not just fire and EMS, it's the all hazards that we provide as the fire service. So not so much as an alert, as a matter of we use it to manage the resources that we have in a way that we share them in the way we describe.
So put otherwise, there's no delay in a request for a specialized service such as hazmat or water rescue, correct?
Correct. And that there's we occasionally have some specialized resources that maybe have some request process, but by and large, yes, it's an automated process, even for most of our specialized resources you described.
Great, thank you.
If I could add on just a little bit to that answer, each of our dispatch centers have protocols as to what type of resources to request based on what the incident is. And that ranges the gamut from everything from medical aid to a hazmat to a plane crash. What this technology specifically does, it allows all of the dispatch centers to see all of the resources that we all have in real time and where they are. And then MyCAD, for example, can see all the resources throughout the county, know where they are, calculate how fast they can get there, and choose the fastest ones regardless of the jurisdiction. That's the backbone, that's the essence of the RESET project.
Does that answer your question, Councilmember Goble?
Yes, thank you both for taking time to answer those.
Okay, any other questions? We do have a question. Is Mike part of our board or is that public comment there, Sylvia?
Pardon me?
Mike, is he part of our board or is he part of public comment?
He is an advisory member representing the U.S. Marine Corps, Mayor.
Okay, Mr. How about you say it and then I'll repeat after you.
Mikulovich.
Okay, see, I would have said Mitch. Well, good. Mikulovich, I stopped. Okay, Mike, you're up.
Hey, I got a question about what's the, I missed a couple minutes at the beginning of this, but what CAD are you using? What's the name of the company is providing that for you?
So the individual communication centers have their own CAD systems,
Yeah.
and that varies. In San Diego, it's a combination of a vendor called Central Square and then Paraton for the other two.
Okay.
And there's others out there. So the vendor in the middle, or the hub, is we have an existing vendor by the name of Cologic. We went out to RFP here last year and we had 4 respondents. So we got a good look at what else was out there. So the new vendor, they are a CAD company, but they also sell or provide this CAD hub or integrator.
Okay.
It's the hub is designed to connect disparate systems.
Okay.
So the CAD hub on that one is Central Square.
Okay, and my question is, because we're tying our 4 PSAPs into the new state NG 911 system. So is that going well as far as your new CAD system?
Yes, like yourself, most of the public safety answering points are in that process of the next gen 911. And
Yes.
so we are making progress on meeting those requirements also. And certainly within that, there's connectivity and standards for information sharing, as you know. So all those things will help support this concept of information sharing across disparate systems where we all make individual procurement decisions on our CAD vendors. So yes, those are all goals of Next Gen 911. And that's the project that I described today, is to have that means of connecting those and letting those systems talk to each other that might be different.
Okay, can I ask you one more question?
Sure.
Okay, so are you updating your CPE too at the same time? Because we're looking at doing something similar, because we have to update our CPE to really use everything that NG 911 gets us.
So I can only speak for the city of San Diego. That's who I work for. We're not updating our customer premise equipment at the moment. We're okay at the moment. I'm not sure what the other centers, what their status is, but I think, as you know, the state of California Office of Emergency Services is working to that process of updating CPE equipment. Sounds like you're engaged in that, so you understand it.
Okay, hey, thank you so much for allowing me to ask a question.
You're welcome. Thank you.
Okay, seeing no other hands. Ms. Sylvia, do we have any members of the public wishing to address us on item 4?
No, Chair, we do not have any members of the public for this item.
Fabulous. Any additional member comments? Seeing none, this was for information only. And because both Dr. Burke and I like backup plans, and people in public safety also like backup plans to the backup plan, we're going to go and provide, as I mentioned earlier, Councilmember Frank has stepped up. Should I have to step away or have to do anything with this airport, we need a chair. So before we begin, I would like to again thank Councilmember Kaylin Frank, who has generously offered to serve as a vice chair pro temp for today. So unless anyone would like to make another nomination, may I have a motion to approve Member Frank as serving as the Vice Chair Pro Temp for today's meeting of January 21st, 2020. Looking for a motion.
So moved. Anderson.
Thank you.
Global
Mr. Anderson.
second.
Global second. Okay. Any other discussion? Seeing none, please call the roll.
For Chiefs Sheriffs Association, seat A, notated as absent. For Chiefs Sheriffs Association, seat B, Chief Fred Armijo.
Aye.
For City of San Diego, they're noted as absent. For County of San Diego, Supervisor Joel Anderson.
Aye.
For San Diego County District Attorney, Commander Barbara Retzel.
Aye.
For East County, Councilmember Steve Goebel.
Aye.
For Regional Fire Emergency Medical Services, Chief Rick Boyd. He was here earlier. Perhaps he has left, so I will notate that as an absent. For North County Coastal, Councilmember Keith Blackburn.
Aye.
For North County Inland, Councilmember Kaylin Frank.
Yes, and thank you.
For San Diego Police Department, Assistant Chief Paul Conley.
Aye.
For San Diego County Sheriff, Sheriff William Gore.
Aye.
And I go back to for Regional Fire Emergency Medical Services, Chief Rick Boyd. I thought he was, yes.
Aye.
Thank you. For South County, Mayor Alejandra Sotelo Solis.
Sotelo Solis, aye.
Thank you. The item passes unanimously.
Thank you again, back up to the backup plan. You know, we just never know. So we move on into item, I believe it's item 5, where we are going to be discussing the report from San Diego County Fire Chiefs Association. Oh, look it. Chief Blake, you're up.
Okay, thank you. Are you able to hear me?
Yes.
Okay, looks like my video's froze. Just a couple of highlights from the last San Diego County Fire Chiefs Association meeting. We had a very robust discussion with county EMS about the COVID surge. The spike in COVID obviously has caused staffing challenges to fire and EMS delivery in the county, as well as hospitals, which has resulted in offload delays and ambulance diversion from hospitals. The diversion has been stopped by the county, but we are still experiencing a large number of offload delays in our ambulances, which is not unique to San Diego County. That's pretty much everywhere, at least in California and probably beyond. We are working through those issues, and hopefully we're seeing we're on the other edge of the peak of the COVID spike, which will be very helpful. The rest of the meeting was just routine business and a continuation on our work of our 5-year strategic plan. And that's the end of my report.
Thank you so much, Chief. Okay, are there any questions or comments, members of the public? Any comments from my colleagues here on the virtual dais? Okay, seeing none. Thank you so much, Chief. We appreciate you. All right, we now move on to item 6. It's new grant funding. It's Project Safe Neighborhoods. Fiscal agent, Dr. Burke will be walking us through it. Dr. Burke.
Yeah. Hi, thank you. Yeah, we have 3 action items for with new grant funding. So that's a good reason to have action items. So this first one is actually going to be a recommend to the board of directors, given the amount of funding that we have. And just as a reminder for the committee, for all 3 of these grants that we did work with partner agencies in the county with, we do go to the PSC chair and also the board member before we try to seek any additional funding. Because we're amending the FY22 budget, that's why we come to you for approval or the board. So for this first item, it's PSN fiscal agent. The U.S. Department of Justice provides money to the 94 judicial districts across the United States. And they've been doing this for a number of years. It's a project called Project Safe Neighborhoods. And because the U.S. Attorney's Office is unable to actually receive funding themselves, they need to seek a fiscal agent. SANDAG has served as a fiscal agent for Project Safe Neighborhoods for the Southern District of California and San Diego previously. And what this funding goes to do is to form collaborations to try to address and investigate strategic planning for preventing violent crimes in those respective districts. Because of our experience being a fiscal agent for the Southern District of California, as well as our experience receiving federal funds, and also our work as the Criminal Justice Clearinghouse, the Southern District of California recommended us to both the Central District, which is Los Angeles, the Eastern District, which is in Sacramento, and the Northern District in San Francisco. And for that, we'll be getting 10% of the grant funds to ensure that those funds are appropriately used in those districts. We do not make the funding decisions, but we are establishing those contracts with those entities. So the recommendation today that we're asking you to consider is recommend that the Board of Directors approve a budget amendment to the FY 2022 overall work program and budget to accept this $1.94 million in funding on behalf of the 4 U.S. Attorney's Office in California from the U.S. Department of Justice. And again, SANDAG would get 10% of those funds to do this administrative assistance. I'm happy to answer any questions or turn it back over to the chair for a motion.
Okay, and this would be to be a fiscal agent for and receiving these resources on behalf of our U.S. Attorney's offices in California. So I think anytime we can assist, I say let's do it. As long as we have an administrative fee that we do cover any staff time. Just want to make sure that that is included in there.
Yes.
Outstanding. Any other discussion from members of the dais? Okay, I'll ask, are there any members of the public wishing to address us on item 6?
No, Chair, there are no members of the public for this item.
Okay, seeing none, I need a motion to recommend the board of directors.
So moved by Anderson.
Thank you, Mr. Anderson.
Second, Gore.
I have a second, Mr. Gore. Any other discussion? Seeing none, please call the roll.
For the chiefs, sheriffs, Association Seat A, listed as absent. For Chief Sheriff's Association Seat B, Chief Fred Armijo.
Aye.
For City of San Diego, Council Member, I'm sorry. For City of San Diego, they're noted as absent. For County of San Diego, Supervisor Joel Anderson.
Aye.
For San Diego County District Attorney, Commander Barbara Rutzel.
Aye.
For East County, Council Member Steve Goebel.
Aye.
For Regional Fire Emergency Medical Services, Chief Rick Boat.
Aye.
For North County Coastal, Council Member Keith Blackburn.
Aye.
For North County England, Council Member Kaylin Frank.
Aye.
For San Diego Police Department, Assistant Chief Paul Conley.
Aye.
For San Diego County Sheriff, Sheriff William Gore.
Aye.
For South County, Mayor Alejandro Sotelo Solis.
Sotelo Solis, aye.
The item passes.
Well done, crew. We are moving quite long. We now move on to item 7, and Dr. Burke, you're up.
Yes, so this one will actually be an approval item because it does fall in the purview of the amount that the PSC can approve for $300,000 in funding. And as Supervisor Anderson is aware, the County of San Diego recently released an RFP entitled Data-Driven Approaches to Protecting Public Safety, Improving and Expanding Rehabilitative Treatment and Services, and Advancing Equity Through Alternatives to Incarceration. SANDAG did reply to that RFP and was selected as a desired consultant to work on that project. We're waiting to sign the contract pending PSC approval. Key considerations, they were looking for somebody to partner with a research entity who would be able to compile data and work with stakeholders to conduct a data-driven approach to identifying the primary policy drivers of reduced incarceration rates during the period of the COVID-19 pandemic. As part of this effort, SANDAG staff in the Criminal Justice Research Division will identify available data, analyze jail population changes, conduct a gap analysis related to services and supports, review best evidence practices, and make recommendations that incorporate feedback from diverse groups, prepare a comprehensive fiscal analysis so that we can look how we're best making use of taxpayer dollars, and publish a series of written reports and updates. The PSC is asked to approve a budget amendment to the FY 2022 overall work program and budget to accept $300,000 in funding for the data-driven study Alternatives to Incarceration project from the County of San Diego pending the successful contract negotiations.
Okay, so we have a recommendation for us. Do we have any members of the public wishing to address us on this item?
No, Chair, I don't see any members of the public.
Okay, any members of the Public Safety Committee would like to share any comments or have any questions for Dr. Burke? All right.
This is Sheriff Gore. Let me just, if I could
Go ahead.
quickly, just Sheriff
Sure.
Gore. This is a very important study, and I really thank Cindy and her team for taking this on. I look forward to the results. So thanks, Cindy.
Thank you, Mayor.
Great, thank you, Sheriff. Okay, seeing no further discussion, I need a motion to approve the budget amendment.
So moved, Sheriff Gore.
I have a motion from Sheriff Gore,
Second, Anderson.
second from Supervisor Anderson. Any other discussion? Seeing none, please call the roll.
For the Chief Sheriff's Association Seat A, noted as absent. For the Chief Sheriff's Association B, Chief Fred Armijo.
Aye.
For the City of San Diego, noted as absent. County of San Diego, Supervisor Joel Anderson.
Aye.
San Diego County District Attorney, Commander Barbara Rutzel.
Aye.
East County, Council Member Steve Goebel.
Aye.
Regional Fire Emergency Medical Services, Chief Rick Boat.
Aye.
North County Coastal, Council Member Keith Blackburn.
Aye.
North County Inland, Council Member Kaylin Frank.
Aye.
San Diego Police Department, Assistant Chief Paul Conley.
Aye.
San Diego County Sheriff, Sheriff William Gore.
Aye.
South County, Mayor Alejandra Sotelo Solis.
Sotelo Solis, aye.
Thank you. This item passes.
Outstanding. We now move on to item 8. Dr. Bird, you're up.
Great. So last but not least, in 2015, California passed Assembly Bill 953 called the Racial and Identity Profiling Act, or RIPA, that required each law enforcement agency that employs peace officers to annually report data on all stops to the Attorney General with the goal of preventing racial profiling and equity. It was a rollout system where larger agencies had to report at more sooner than the smaller agencies. And the Chula Vista Police Department will be one of those agencies that was required to begin compiling and reporting this information in January of 2022. And when a funding opportunity came out from the Bureau of Justice Assistance that was called Smart Policing, the Chula Vista Police Department approached us and we partnered on a grant application to look at how could we potentially partner to efficiently and effectively track this RIPA data, using the data to inform areas for improvement and document if desired outcomes are achieved. Sandak has worked with the Chula Vista Police Department before, and all our staff have gone through the background checks to work on these data. It will be a 3-year project that will include utilizing new data sources and technology as part of something that's called the SARA model that's used in law enforcement, where we scan for a problem, analyze data to understand how we can address that problem, create a response, and then assess if that outcome is achieved. So that's where the SARA acronym comes from. Identifying possible disparities and regularly sharing this information with the community, which will be a very key part. Addressing risk factors that could contribute to disparity through targeted interventions, and documenting the effectiveness of interventions, and creating also a practitioner toolkit for other jurisdictions. This is obviously a very important effort for the region that I think will be of use to all of the local agencies. We'll definitely be coming back to the PSC with information about this project as it continues. The action that we're asking for, again, this did come in under the 500,000 threshold for the PSC to actually approve this amendment to the budget. So the Public Safety Committee is asked to approve a budget amendment to the FY 2022 overall work program and budget to accept $496,166 in funding from the Bureau of Justice Assistant Smart Policing Initiative from the U.S. Department of Justice. I'm happy to answer any questions.
All right. Thank you so much, Dr. Burke. Are there any members of the public wishing to address us on this item?
No, Chair, there are no members of the public to address this item.
Okay, PSC members, any comments? All right, now I'm looking for a motion to approve the budget amendment.
So moved. Anderson.
Motion from Supervisor Anderson,
Conley will make a second.
Connolly, member Connolly, second. Any other discussion? Seeing none, please call the roll.
Chief Sheriff's Association, seat A, absent. Chief Sheriff's Association B, Chief Fred Armijo.
Aye.
City of San Diego, absent. County of San Diego, Supervisor Joel Anderson.
Aye.
San Diego County District Attorney, Commander Barbara Rudsell.
Aye.
East County Council Member Steve Goebel.
Aye.
Regional Fire Emergency Medical Services Chief Rick Boat.
Aye.
North County Coastal Council Member Keith Blackburn.
Aye.
North County Inland Council Member Kaylin Frank.
Aye.
San Diego Police Department Assistant Chief Paul Conley.
Aye.
San Diego County Sheriff William Gore.
Aye.
South County Mayor Alejandra Sotelo Solis.
Sotelo Solis, aye.
This item passes.
Okay, thank you, crew. Checking our line, we're on item 9, and it's the drug availability and overdoses in San Diego County. An update from the DEA. We do have a partner who will be giving a presentation, that Special Agent in Charge, Shelley Howe, from the U.S. Drug Enforcement Administration. Shelley, take it away.
Hello, thank you for having me. I appreciate the invite. My name is Shelley Howe. I have recently been selected as the special agent in charge for the San Diego Field Division. A little bit of my past, I was promoted here to a group supervisor in 2012 from Minneapolis, Minnesota. So the warm weather was a very nice change for me. I was assigned to the San Ysidro resident office where I was for 3 years. And then I was promoted to the resident agent in charge of that office for 2 years and ran 4 groups down there. I was then pulled into headquarters for 15 months where I worked with our Office of Professional Responsibility, our OPR. And then I was promoted to our Principal Deputy Administrator, the #2 in DEA, before being promoted to an Assistant Special Agent in charge for the San Diego Field Division. I was lucky enough to come back. So I've been back since 2019. And so 3 years later, I'm taking over the office. So I'm very glad to be back. I love San Diego and I love the law enforcement community here. So next slide. Here we're focused on 2 major threats that we're seeing in San Diego Field Division AOR, methamphetamine and fentanyl. These are the seizures from January 2020 to June 2021. Now this chart is going to depict the seizures reported to EPIC. These are going to be state and local federal law enforcement seizures in San Diego and Imperial counties. Now these seizures can be at the port of entry, checkpoints, traffic stops, search warrants, abandoned, basically anything that required us to pull an FDIN number. You'll see that the extreme difference between 2020 and 2021 in seizures. And one thing to know about our fentanyl seizures is these are not pill totals. So I can't give you how many pills were seized because it's weighed and not counted. And there was also a significant increase from 2019 to 2020. Next slide, please. I know a lot of you on this call are trained in this field and should have a well-trained eye to be able to pick a counterfeit pill. As you can see in this picture, it would be difficult for us to do that even. The drug traffickers are taking advantage of this. Fake pills or prescription pills and the misuse in the United States is at an all-time high. Everybody is aware of that. The media is all over that, and we need to do something about it. Even the people that are using these pills that know they're not prescription pills, there is no way for them to tell how much fentanyl could be in these pills. The best analogy I've heard so far is when you make chocolate chip cookies. You don't know how many chocolate chips are in each cookie, right? So let's say the lethal dose is 5 chocolate chips. 1 chocolate chip cookie is going to have 5 chocolate chips and the next is going to have 7. You eat the one with 7, it's the last cookie you're ever going to have. Users are not, even users that are handling actual prescription pills, you know, there's a greater danger of overdose for them. The other trend we're seeing is if we're having recovering addicts, if they fall off the wagon. So they go back to using pills, their tolerance isn't what it used to be. And we're seeing a lot of overdoses for recovering addicts, unfortunately. Next slide. The trend that we're seeing not only is coming from the border, but you know, online pill sales is increasing. What does this mean for us? It means that our kids have easy access to it. They're looking at it on their phones. They're looking at it on the internet when we're not around. The availability is there. They don't have to go down to, you know, the dark streets of San Diego to pick something up, an illicit drug up. They can order it online. They can run down to the mall and they can make an exchange. That's one of my priorities coming in, is getting more into the dark web aspect of it. We have done cases where we've been able to make some arrests and seizures off of meeting people on Instagram. So that's one of the directions we want to head here at DEA. Next slide, please. Fake pills are so dangerous. DEA's testing reveals that 4 out of every 10 pills contains a potentially lethal dose of fentanyl. Again, I go back to my chocolate chip analogy. You just never know what you're going to get. If it's not manufactured in a sterile environment, pharmaceutical setting, you don't know what you're getting. And the other thing that we're seeing is that the purity is increasing in Mexico and coming across. This is not a good thing for our country. Next slide. Take a look at this slide. This is what is scary, and this is what we need to get out to the public. This slide depicts, and if you look at 2021, the fentanyl in the blue is about even with 2020. 2020, the blue is for an entire year. 2021 is only till June of 2021. So that means that data is not in yet. You can anticipate that that is going to double. So what we're going to see this year in 2022 is our fentanyl overdose deaths surpassing our meth overdose deaths. Again, it's a cry for help. We need to get something done, and we all have to take a unified stance to make that happen. A couple stats that I want to share with you. If you're to look at mid-year, where we're at on this slide for 2021, we're at about almost 400, about 381 overdoses for 2021 if you're looking at this slide. For that same time frame in 2019, that's 69 deaths. So we're on point to be well over 800 by the time those numbers come in. Next slide. So what our new administrator is pushing is we're launching the One Pill Can Kill campaign. This is our response to this nationwide problem. It's a two-pronged response: enforcement surges, and public awareness campaign. Next slide, please. Here you can see the 2 enforcement surges we've done, phase 1 and phase 2. Now I'll let you in on a little background on this slide. The administrator reaches out to all the divisions and says, okay, on this date, we're going to do a nationwide takedown. Please make sure, we're arresting our fentanyl sources of supply and going after this so we can put this on our campaign. These are short time turnarounds. This isn't the cases that we have long-term wires on where all of a sudden we're taking down multiple defendants. This is stuff that our agents are pulling together last minute, and we're getting 10 arrests and 40 arrests. Now, if we had enough time to make pre-planned takedowns on our cases, these numbers would be a lot higher. Next slide, please. As I was saying, we're trying to get out a unified message. We have to take a stance together. And what we need to push out is we should never be taking any medicine that isn't prescribed to you by your own doctor. We need to talk to our family and friends about the danger of buying drugs. These people, they look like you and I. They're the kid next door. They're a police chief's son. We've had it hit as close to home as being one of our own TFO's relatives. This will touch us all at some point. These aren't the typical meth heads that we've been dealing with for years. This is different. When we grew up, it was the just say no. We have to stay away from being addicted to drugs. Don't take that marijuana because, it's a gateway drug and it'll lead to other drugs. It's different. Right now, one pill can kill. That's it. That's the message we need to get out. It is not a media push. It is not the media pushing their agenda. This is a real problem. It's a real problem here in our county. And we are trying to reach the public through social media, media outlets, and in-school education. Next slide, please. So DEA is currently partnered with San Diego County Office of Education under Operation Prevention San Diego. And we're doing this to provide resources to educators, parents, and students. You can go to the next slide, please. And here's some information. If you know an educator that is looking for resources, please send them to this site. Have them reach out to our office if they need more information. We will do absolutely anything we can and give them guidance or the education they need to help educate the students or parents or any other community organizations. Next slide. We also have a overdose team. We call them Team 10. It is formed to help the city of San Diego respond to overdose deaths. Next slide, please. Team 10 is comprised of 7 agencies. Currently, we're responding to only overdoses in the city of San Diego. And you know, we are so busy and this team is so overworked that we had to triage the call outs. So if San Diego Police Department or fire responds to an overdose death, they will call our sergeant in Team 10. And basically they will go through a checklist. Are there witnesses? Is there a phone? What is the age of the decedent? And what we're trying to do is we're trying to make this overdose something that DEA and this team can make actionable. So what we're trying to do is we're trying to go get into this person's phone, trying to find this source of supply so that we can stop this if it's you know, a bad batch of pills, if somebody is trying to sell cocaine laced with fentanyl, we're trying to get ahead of it. So we really are trying to be proactive. And as a matter of fact, they're out on a call right now. And, you know, there could be 3 in a day, there could be 7 in a day. Sometimes when we're lucky, you know, we can go a week without getting a call, but that is any more very rare. Some of our successful cases in November of 2021, we had 3 defendants that provided drugs that caused a fatal overdose. These defendants received 13, 14, and 15-year sentences. That is a huge win for us. And these cases are what makes the daily grind for this overworked team worth every minute. And that is our goal. We're here to partner up with the locals, law enforcement officers, and try to make our community better. Next slide. That's it. Thank you for your time. If there's anything you ever need from DEA, please don't hesitate to reach out.
All right, well, thank you so much, Shelley. Really appreciate that presentation. And like you said, it's not the say no to drug. It's not the dare, you know, the crime or the criminal that you had, you know, that we're used to. But it's like you said, it's the person next door. So definitely shedding light on that. I do have hands raised. I have Councilmember Goebel.
Thank you, Chair. Shelley, thank you for a great presentation and for being part of our discussion today. I'd just like to share a couple data points from my experience in the city of El Cajon that you may already know or you don't, so I'll just go ahead and share. I agree with you that fentanyl is not something just by a certain group of people, those that live on the street. It doesn't discriminate between income or age or things like that. It's everywhere. There is a local school district who has chosen, I'm going to talk about Narcan a little bit, the other side of it. The local school, one local school district does not want to carry Narcan because they feel they have a sense of personal liability or legal liability. That's a stigma because we know Narcan does not work if there's no overdose condition present. So there's not really a problem there, but you might consider the school district angle because these kids they have it too. And I don't know how we overcome the school district's stigma of not carrying it on campus, perhaps. That's my first point. I don't know if you want to address that one or.
Sure, if you don't mind. You're exactly right. We just had a meeting on this yesterday, and one of the areas we feel that we need to do better at is the age 8 to 11. And the reason being is because, you know, I showed you the pills. They look legitimate. And to an 8 to an 11-year-old, they're not going to be able to tell. But what they're so used to us pushing as parents is, here, this pill is going to make you feel better. This pill is, when we go to the doctor, we go to the pharmacy, they prescribe a pill and we take it. It's stamped, it looks good, it's going to make me feel better. That's what an 8 to an 11-year-old knows. And so when these, you know, illegal pills or counterfeit pills are pushed out to that age group, they don't know the difference. So you're right, the education there needs to be better. The other conversation I've had, as a matter of fact, today, is getting somebody, I have a vacancy in that role right here in my office. And we just talked about somebody that was going to fill that role and get back into the schools and have these conversations. And that is, I need the community's help to get out to these schools, to tell the parents that it is there. And if you can reiterate what I'm saying to you, maybe it'll get to them, instead of having a law enforcement officer constantly be the one, you know, the whole drugs are bad thing. So I appreciate that comment, and I agree with you.
I think once you get that staff position available, I would certainly be interested in connecting with that person, that maybe we could go visit these school districts together.
Absolutely.
Yeah. One of the other challenges to the message of one pill can kill is my experience from administering Narcan to people living on the streets is they feel empowered because they know they can go to these social service agencies and get Narcan freely, which is a good thing because ultimately we want to save lives. That's the bottom line. But the challenge is, I think some people on the street feel they have less risk because they know they have this antidote freely available. That's a challenge. But it is a huge issue, this fentanyl. In a recent 6-month period of 180 days, our first responders in El Cajon administered Narcan 197 times in 180 days. That's AMR, PD, and fire. That's more than one a day, just the Narcan. I can't tell you, I don't have the number of as many deaths, but absolutely it is a growing problem. It's real, and it's very dangerous.
Sir, first of all, I have a couple comments. Dr. Burke, do I have time for this?
Oh, yeah, definitely. Okay. This is a great discussion, so please.
Okay. So first of all, I want to go back. Please get Dr. Burke your information. I will get somebody in contact with you, and we can work on the school situation sooner than later. It's extremely important to me. Second of all, here's something else I'm trying to work on. I've talked to many people that I've met with about this. It is OD maps. What I am trying to get going in this county is OD maps, so we can identify the hot spots. Right now, we have no way to identify that. If I'm the only agency putting in information into OD maps, it does nothing. If I am the only person, working that, we can't identify the problem and where to hit the entire county. The other thing is so when you're saying that the first responders administered 100 and some times, there's no documentation of that. So I don't know John Smith has overdosed and they've gone to him 4 or 5 times. I don't know that. So I don't know, I can't send anybody to them and say, John Smith, why don't you talk to me? Why don't we see who, are you using cocaine? Are you using pills? Who's your source of supply? Can we get you help? The only time we go is when they're dead. So we're missing a fire call out, a rescue call out, if they're approached by, let's say the PD responds and they hit them with Narcan. We don't get that. I have no information on that. Nobody does. And so there's nothing we can do to help or an individual that we keep hitting the same time. Does that make sense?
It does. Let me ask Cindy, didn't we have a discussion on this maybe last September, October? And wasn't there a regional agency representative that said they get some of these numbers sometime, but not all police agencies participate in that? Is that something we might be able to connect here?
Yeah,
And
so
really quick, before Dr. Burke, you answer that question, I am gearing up to head off to my gate because they just called our flight. So I am going to turn this over to Vice Chair Pro Temp, Frank. So take it away. Great presentation, Shelley. Good questions, Councilmember Goebel. And I would say, if I can help as part of the PTA, my children are exactly in the age group that you are discussing. I think the teachers are also an essential component to getting the word out. And whatever I can do to help, please let us know. Work with through Dr. Burke. Let's make it happen. Take it over, Chair Frank. Yeah, thank you.
yeah, we had a presenter from the Law Enforcement Coordinating Center, which I'm sure Sackhow is familiar with. They're doing a mapping regionally of naloxone dissemination. And we also hooked them up with Family Health Centers of San Diego. I chair the Syringe Exchange Facilitation Committee for the City of San Diego. And a lot of the service providers also collect data that isn't part of that system. So that is a mapping project that the Law Enforcement Coordinating Center is doing. So definitely happy to facilitate this conversation and continued work.
So the mapping where we're just getting the administration of the Narcan is great, but what would be even better is the documentation or a law enforcement officer able to document to get the name so that there can be some type of follow-up. You know, we're trying to save lives here. We don't know. I mean, we have cases where people are using cocaine, 5 go down, 3 die. So it would have been nice to, you know, to get in there if this has been happening in that area and there have been near misses before. So we can't go when we don't know who they are. And you know, we're asking law enforcement officers to do more with less. We take down names and we try to get a call out that taps them down and locks them down longer than they normally have.
I think you raise a good point. I think where I just kind of, if I were to summarize my thoughts, would be say, it seems like we have some systems out there today that are connected, and maybe there just needs to be a discussion among the participants of what fields are being captured, what information is being input. It might be there, we just need to connect the dots. It may be another step, I don't know, but that's probably a good discussion among the participants in that technology. So thanks for your time.
Thank you.
Thank you so much. Are there any other board members that had any comments or questions? I'm not seeing anyone unmuting, so we will move on to our last item, item 10, update on regional retail theft patterns. We have Detective Mike Martinez from the Escondido Police Department and Cindy Anderson from Carlsbad Police Department. This is an overview and discussion of recent smash and grab thefts and regional efforts to address them. Here we go, item 10.
Hi there, everybody. Hello, my name is Detective Mike Martinez. I work for the Escondido Police Department, and I'm here to talk about the recent crime trend that we're seeing in regards to what's being quoted as flash mob robberies. And that's because it's very prevalent on the news right now. I'm sure we're all familiar with the great video of what's been taking place. The most recent one I comes to mind is the incident at the Nordstrom in the Walnut Creek area. And it's pretty graphic. It's kind of shocking to those who don't see these types of things very often. And because it's in the media, it grabs our attention. But I have some news to share in regards to that. Unfortunately, this is nothing new to law enforcement, and this is nothing new to those of us who prosecute these types of crimes. This type of crime is something that we refer to as organized retail crime. So if we can go ahead and skip down, I believe it's going to be slide number 3. Thank you. So what is organized retail crime, or what we call ORC? That's the definition of it right there on the screen. But essentially what it is in a nutshell, these are criminals who are waking up in the morning, collectively meeting and going out from location to location to location, stealing as much property as they can get a hold of. And the reason why they're doing this is simply it's money. It all comes down to the money. So they'll take the items, they'll take what is stolen, and they'll go ahead and they'll flip it commonly in fences, small businesses who resell, or just the general public who might be looking on some type of social media platform for a deal. There's other ways of getting rid of the stolen property, and I'm not going to get too deep into that because we can go on and on and on. NPR estimates that in 2019, it was up to $69 billion worth of stolen goods during that time period. This includes over-the-counter medication, alcohol, clothing, underwear, fragrance, baby formula, etc. It just goes on and on. So just think of whatever the hot topic is of the moment, that's what's getting stolen, and that's what's getting flipped. Let's go ahead and move on to the next slide, please. Thank you. So since I started investigating ORC, I want to say this is back around 2007, 2008. We ended up, from our own mistakes, learning that it was better to go ahead and create an alliance between law enforcement and private business. And so what we ended up doing was developing and organizing what's now called SD-ORCA, San Diego Organized Retail Crime Alliance. And what that is that is a platform for all of us in law enforcement to work with private retailers, loss prevention investigations, and get to a place where we can have a meeting, share information as it regards to new and emerging crime trends, share suspect information, collaboration, and giving case updates, where we get to, and it's not very, it's very common for us to get together and solve these major cases just by having these once in a while meetings. And Cindy Anderson from Carlsbad PD is also on. So Cindy, if you can just mention just a little bit what you do in Carlsbad, your network of people, and how you're able to assist us with getting this information out.
Thank you, Mike. Can you guys hear me okay? So like Mike mentioned, we've been working together for a long time now. I've been with Carlsbad PD for 15 years and was there when he first started the SD-ORCA. So Mike has done such a phenomenal job with all of this. So my job is tracking cases from not just within the county, but as well as outside of our counties, throughout the state, throughout the southwestern region. What Mike's talking about, these BOLs, these be on the lookouts, I receive them from Sacramento, Northern California, Arizona, Texas. So I receive these bulletins, and that's what tells us what's trending right now, not just in San Diego County, but what's nationwide. What is that hot item that Mike is talking about? You know, what's the item of the week? So that really helps us prepare for what's going to, what's headed our way. Because usually it starts up north. A lot of times we see it start either in Northern California or Los Angeles before it makes its way down to San Diego. So thankfully we get a little bit of a heads up. And like Mike had mentioned earlier with the case up in Walnut, I talked to the crime analyst up there. She's my counterpart. She does what I do, but up north. And she said they were actually alerted of the incident about 5 minutes before it happened, because another agency had intercepted some social media posts, and they actually called Walnut Creek PD and said, hey, we saw this post, they're headed your way, but unfortunately it was too late. So this kind of sharing of information is really crucial for all of us, because we're able to expect what's happening before it happens. We're able to predict it before it happens. And so I stay in constant communications with my counterparts, similar to how Mike stays in communication with the loss prevention agents and fellow detectives. The crime analysts, we have a really good network. And so we've identified crime analysts that either do the SD-ORCA, or I'm sorry, the organized retail, or even just ones in cities like Carlsbad that have main that are along the main thoroughfares, that are along the main freeways, such as the 5 and the 15, ones that have high-end malls that are near the freeway, because we know those are going to be more likely to be targeted. So we work really closely with them, and that's how we're able to be able to predict when it's going to head our way. We don't always know, but we stay in constant communication so that we can kind of try to get a heads up. And then with these bulletins that Mike's talking about, we're able to compare pictures. We're able to compare the MO, how they're doing things, any vehicle information that they have. So it's just really, really crucial for all of us to stay in constant communication. And that's where people like Mike and I come in, because we're really good at keeping in touch with people just like us throughout the nation. But thank you, Mike, for that intro. So.
Thank you, Cindy. I appreciate those comments. Going on to our next slide, please. I'll continue. So like I mentioned earlier, ORC is nothing new to us, but it is, however, always changing, growing, and essentially it is a living and breathing thing. In reference to the new flash robberies that are on the media, here's a little case that we did work locally down here in San Diego, and this was all across the county and beyond. So real quick on the background, we had several suspects that started out by, or at least we know, going to the Apple store in Carlsbad, and this is back in 2018 in May. They walk in as a group. They steal, I think it was something around $32,000 in cell phones and laptop computers from the display counters. This is during business hours. They didn't smash any windows. They just went in as a group, grabbed all these items, walked out, and took off. And we didn't see them again until they reappeared in the Escondido Apple store on June 11th. And that's how I became involved. Cindy and I already have this established relationship. I contacted her. We shared information as police departments. And we ended up deciding to host a meeting where we invited all law enforcement agencies across the San Diego County to attend this meeting where we could share information. And next slide, please. After doing so, sharing that, next slide, please. After doing so, I ended up getting contact by another law enforcement agency who was able to, upon seeing the media releases that you're seeing right now on your screen, he recognized some of the faces. Now, the images that you're seeing right there, those have been blurred out intentionally for this meeting. They do contain some really clear and identifiable images that are in there. So Detective Gillen from the Chula Vista Police Department, next slide, sees these images and he contacts me and he says that he too is also working a similar case, only this is kind of like a low-level case of property crime where our suspect goes in and steals iPhones, more Apple products from the local Walmart. So next slide, please. And so it would be the gentleman that's wearing the black hoodie that has the Nike logo on his chest. He recognizes him. He's a known suspect to him. It matches our video that we have in Escondido. I share that with Cindy. It matches her video from over there. So we have at least one suspect involved in at least 3 separate incidences all across the county of San Diego. So we know that we're definitely on the right track. But of course, as you all know, as soon as we release information to the public to share, next slide, please. That's when the bad guys stop doing these particular types of crimes and shift and start doing another type of crime. This is later investigated by the San Diego Police Department as a party robbery series that begins. During this party robbery series, our suspects will attend these parties. They go in, a bunch of young people, college age and such, and they'll go ahead and commit strong armed robberies, stealing everyone's cell phones and eventually stealing wallets containing credit cards. Next slide, please. While working with the San Diego PD, Detective Sidhu from San Diego PD contacts me and she says that they are on this case. She thinks it could be related to ours. And in fact, through the course of surveillance, they end up identifying a suspect. That's going to be the gentleman on the left wearing the red hoodie as part of this group that's doing these robbery series, who we later take into custody, charge them with all these many burglaries and these robberies. And we are able to identify several within his group. taking everybody into custody eventually. And can we move on to the next slide? Thank you. Eventually what happens is all of our lower level criminals in this particular crime series take some kind of a deal to avoid long sentences in prison. Our main suspect declined to do so and effectively guaranteed himself 21 years and 4 months in prison by taking this to a jury. So if we can go to our next slide, and you might want to hit the space button a couple times. Like I mentioned earlier, as we are attending these SD ORCA meetings, we're able to go ahead and share our crime trends, our information bulletins, and just keep on hitting that space button, please. Thank you. And there's some bulletins that you see. That's an actual bulletin from Cindy's team, where we go out and we catch these bad guys with shopping lists of things that they're supposed to go buy and how much they're going to get paid for it. And it's all percentages and what they're going to do with it. We also provide training to local law enforcement. And one of the things I like to kind of brag about is that we're a force multiplier, that although Cindy is a team of one and doing the job that she does, I'm also the only commercial burglary detective at the Escondido Police Department. I have over 1,000 partners because of this force multiplier that we created through SD ORCA. And last slide. So at this time, if Cindy and I can respond to any questions, we'd like to do so.
Thank you so much. Do we have any comments from the public?
No, I don't see any comments from the public now.
Okay, with that, we will move to board member comments. I see Eric Wood's hand raised. Let's go to Eric.
Oh, sorry for the lighting. Director of Argus, Eric Wood. My question is if there are specific tools that would help you as you are working these types of crime cases, crime series, that that would just make the job easier, more effective. Argus is always trying to help our law enforcement partners. I'm just kind of wondering if there's tools, whether it be software and data sharing, or whether it be LPR. I noticed in one of your alerts you mentioned that the no suspect vehicle information, but would LPR have helped, or are there other tools that we'd really need?
I would add that Argus has been great with us, and Mike can speak to it too, but especially with sharing, being able to share the bulletins that we produce, sharing information and getting contact information through Argus. Argus has been wonderful with that. So.
Appreciate that.
Speaking on our side, serving as executive director for our organization, I like to brag a little bit that when we started, we had a budget of $0, and now we've been in it since 2008, and our budget is still $0. And we do that all through donations through private businesses who are able to help us out. So we have retailers who on the outside world are competitors with one another. Let's just say, for example, Lowe's and Home Depot. Within our group, they are working together and helping us out. And so our number one thing that holds us back is just simply funding. And all the funding is that we need is to support our website, because we communicate mostly through email and website, just like most of us do nowadays, and maintaining that website. And that's pretty much it. Everything else is done 100% volunteer.
Thank you.
Thank you so much. Councilmember Goebel, I see your hand raised. Oh, you're still muted.
You're right. 2 clicks. So the governor allocated $255 million a month ago for this type of crime. Do you see any of that money flowing down to you in these grants to help you?
I'd like to answer that a little bit, but I might be slightly out of place. I don't know if, is it Don Goodman is on this meeting still, CHP?
Yes, I'm on the meeting right now.
Thank you, sir. Would you mind covering that a little bit and how the CHP is being assisted with this funding?
So we have 3 organized retail crime task force, one down what we call border division, but it's San Diego, Orange County, Imperial, and portions of Riverside. one in Los Angeles County and one up in the Bay Area in our Golden Gate Division for San Francisco, Oakland, et cetera, up there. Each one of these task force has one lieutenant, a sergeant, and 3 officers assigned to it. We go out, we handle our own cases. At the same point in time, we reach out to all the allied agencies in our jurisdictions. So San Diego County, Orange County, et cetera. And we assist them with any retail crime cases that they have. Depending on the size of the agencies, some agencies have the ability to handle it on their own. Others do not. And so we will either take it if they don't have the ability, or we will assist them with in any way that they need. We've done, whether it's sting operations or just general follow-up surveillance, we help them in any capacity that we can.
So that makes it sound like money's going to the CHP, but not necessarily to regional or local law enforcement agencies. Am I understanding that correctly?
So when it was initially drafted, yes, it was all going to the High Patrol. They have, they're still in the process of re-upping that, and it's supposed to go to 2026. And at that point in time, once all of that is approved, then we will see where all that money goes. The problem we have with a lot of the agencies, so if we ultimately bring agencies on, it's a lot of agencies are short bodies as they are. And so therefore, they struggle to join the task force. But we have reached out, and in time, we would like to bring agencies on board.
Great. Okay, thank you.
And Councilmember Gobo, if I can answer that too from a city level, I am also the person that handles all of our grants for the city of Carlsbad. So I usually seek out grants. I personally have not seen any grants particularly for this. And I also handle any incoming funding for from the state, and we have not seen it. So
Okay, well, at least to know that the CHP seems to be the point agency for this type of thing certainly helps us know where to go.
And also, council member, I do work with CHP in our local border area, and my point of contact is Lieutenant Brandon Shipwash, and he has been an excellent partner, and his team as well. We work together all the time. Just like was mentioned earlier, we do plainclothes undercover details where we proactively go out into shopping areas, and not just the CHP and Escondido Police, but most of the agencies in the San Diego area. And we collectively work these groups to proactively catch them and dismantle and disrupt.
Great. Okay. Thank you all.
Thank you so much. Do we have any other board members wishing to speak? Last chance. I'm not seeing any raised hands. All right, well, that will do it for our agenda. Our next Public Safety Committee meeting is scheduled for Friday, February 18th, 2022 at 1 p.m. We are adjourned at 2:39 p.m. Thank you all.